Welcome, everyone attending this second health topic, Churchill Fellowship information session. And welcome to our two presenters, Niroshini Kennedy and Maida Stewart. I'll introduce them shortly. They'll be speaking tonight about their Churchill Fellowships. My name is Adam Davey. I'm the CEO of the Winston Churchill Memorial Trust. We're based in Canberra, Ngunnawal country. And I'm going to begin this information session with an overview of what Churchill Fellowships are about, how you apply and what we're looking for. I'd like to acknowledge Australia's First Nations people, the traditional custodians of this land, and pay my respects to elders past, present and emerging. I'd like to welcome any Aboriginal and or Torres Strait Islander people who are tuned in this evening. I'd like to let you know we do have a new and strong Indigenous Churchill Fellows network, and I'd encourage you, if you're interested in getting involved with that in some way, either before you apply or if you are successful, you're most welcome, and you can contact the Trust directly on that. A little bit of housekeeping. Obviously, cameras are off for you, but you'll have opportunities to ask questions throughout the presentations. We'll deal with them all at the end. So you use the Q&A function to ask your questions. You'll be able to see other people's questions. So if someone steals yours, you don't have to duplicate it. If you don't think of a question in time, or you think of a question later on, you can contact the Trust. We've got a small team. You'll be able to call us or email us, or you can attend another one of these sessions over the coming weeks. I'd like to also acknowledge, the very difficult period that I guess the world's gone through over the last couple of years, living through the COVID pandemic. There's been a lot of disruption and uncertainty and suffering. Some incredible work done, particularly in the health sector. And look, I hope that you're attending this session with a positive and hopeful outlook. We certainly are at the Trust. So to get into the presentation, I'm often asked by people, where did the money come from? Or where does the money come from for Churchill Fellowships? And, I think the history is worth understanding. When Sir Winston Churchill resigned as British Prime Minister in 1955, he was 80 years of age, and he'd served under 5 reigning monarchs. He'd survived 3 wars. He'd been a writer, an historian, a journalist, an adventurer, a painter, and he won the Nobel Prize for Literature in 1953. So as you can imagine, there was a widespread desire to honour Sir Winston Churchill and to capture the essence of his public service, his inspiration, his intellect, and even his humour for generations to come. Now, he wasn't perfect, and you can read some insightful essays that we've commissioned. They're on our website that explore Sir Winston Churchill through a contemporary lens. But he certainly was someone who readily believed that anything was possible if you put your mind to it, and that the greatest figures in history were those who made a contribution to their communities and their fellow countrymen. When Prime Minister Menzies announced the news of Sir Winston's death to Australians in January 1965, he announced a public fundraising appeal. And on what's known as Churchill Memorial Sunday, 28th of February 1965, a door-to-door appeal set forth with over 220,000 Australians, supported by the RSL, literally knocking on doors. And such was the support of the community, governments and business that more than £2.2 million was raised, so around $4 million in 1965. It remains one of Australia's most successful public fundraising appeals. And you can read more about that on our website, and there's plenty to read and learn about Sir Winston Churchill. Now, another question that I'm often asked is, who are you looking for? What does a Churchill Fellow look like? And you can read the slide on the screen, but effectively, Churchill Fellows are the types of people who are passionate and committed to an issue or a topic. They want to share, they want to learn and share that knowledge with others so that their communities can benefit. And it's usually something that people have been passionate about for some time, and you can see they'll continue to be passionate about that issue and try and make change for some time to come. So a bit about Churchill Fellowships. They're a unique and prestigious opportunity that is open to Australians from all walks of life. So it's not an academic scholarship. You don't have to finish year 10. It's not about tertiary education. Your topic might be, but the actual fellowship isn't. And it's not a funding grant. So people realise quickly when they're awarded a Churchill Fellowship and they undertake their project that it's very empowering and there's a lot of freedom involved. So you design your projects. We don't chase you up for every dollar you spend. We give you a lot of trust and support to do your work. But a fellowship's not just an overseas trip. It's the start of a lifelong journey and your contribution to make Australia better. Now, a Churchill Fellowship doesn't need to comprise formal research. And we do get, I think, a lot of career researchers, academic researchers applying for and indeed are awarded Churchill Fellowships. But you can use your fellowship to learn new skills, to build networks and observe best practice in your chosen field, to undertake training. So it doesn't need to be a sort of formal research project in that kind of academic sense. The fellowship is for overseas travel only and must be between 4 to 8 weeks and taken in one continuous journey. We've got a few changes I'll mention shortly we're introducing in relation to that. We've awarded nearly 4,500 fellowships since 1965, and each year we award around 100 or so fellowships typically. We didn't hold around last year. First time in our history we didn't, because international travel had been so disrupted. We've still got a couple of hundred Churchill Fellowship recipients waiting to travel, and indeed that flow of travel has started, which is pretty exciting. So Churchill Fellows travel the globe on the widest range and depth of topics and bring back to this country information, networks, projects, products, ideas, and innovation that can make this country stronger. So eligibility, you have to be an Australian citizen, or as of this year, you can be a permanent resident of Australia, and you need to be over 18 years of age. The ability to travel overseas, is generally essential, and we can provide support for you if you have a disability. We actually are now offering the opportunity for people who are physically unable to travel due to disability or perhaps caring responsibilities to undertake their research virtually. And for people living in remote parts of Australia, we'll be allowing domestic travel. So that's you. If you think that's you, give us a call to discuss. This is something that we're newly introducing, and it's based on feedback, particularly from our fellows in the Northern Territory, that there can be many benefits in domestic travel for people living in remote communities and many barriers to travelling overseas. So that's something new we're offering as well. A Churchill Fellowship is an individual project. It's not a team project. And I think that's important, particularly for those of you who might work in team environments where you put together submissions and apply for grants and things like that. This is very different, and you can't apply as a team, and you can't undertake it as a team. There can only be one person awarded the Churchill Fellowship. You can take someone with you if it's appropriate. Then a good example that I do give is that we had a fellow in 2017 who was undertaking his research looking at Indigenous cultural burning land management techniques, and his employer paid for an Indigenous colleague to attend with him, which made a massive difference to the meetings they had with Indigenous communities. And when he's come back, they've done a lot of work together to implement those findings, and that was really useful. So you can take someone with you, or you might take a family member with you as well. That's fine. Obviously, you would pay for them to go with you. If you're undertaking tertiary studies, that's perfectly fine. However, your proposed project for your Churchill Fellowship can't comprise part of that tertiary study that you're undertaking. The reason for that is we want you to commit 100% to your Churchill Fellowship, and that should be the focus. And that's not just for doing the overseas research, but when you come back, there's expectations that you're going to continue to try and make a change, make some impact, implement your findings and recommendations. So in terms of eligibility, I think the most important thing to hear is that a Churchill Fellowship is an opportunity for a diverse range of people from all walks of life. And that's something that's bandied around a lot, but for us, it is certainly our mantra, and it's what we strive to achieve. A project must be suitable for a fellowship, obviously, and one of the key aspects of that is that you can demonstrate there'll be a benefit to the community in some way through you bringing back and sharing your knowledge, your ideas, your practice, or your skills. You must demonstrate that you have fully explored your topic or issue within Australia to be considered for a fellowship. And I think hopefully, obviously, the reason for that is we don't want to pay to send you overseas to learn things you could have learnt in Australia. So that's really quite critical. A project has to be a self-contained project. So it can't be partly funded by another organisation or form part of a project you're undertaking through your work. We're not an external sort of travel budget opportunity for an existing piece of work. We're offering an opportunity that you wouldn't otherwise get to research a topic. Your project doesn't need to relate to your employment. It can, and it often does, and people will have opportunities to come back and share their knowledge and skills and implement findings because of where they work, but it's not necessarily intrinsically linked. It's really about your networks, your abilities, your passion, your drive to do something with your project on your return. We don't set limits on the topics or the issues, and that's a real strength of Churchill Fellowships. If you can think of a topic that's going to be a good project, then you can convince us of that. So you do really design your own projects. It'll be up to you to put that project to us in a way that makes us see the benefit to you and to the community in you undertaking that research. We do offer some sponsored fellowships, which are either the result of someone leaving a bequest to the Trust as part of their own legacy, or we have generous individuals and organisations who've agreed to fund a fellowship on a particular topic or for a particular type of person to be awarded. And that doesn't mean that they're always awarded. Some of those fellowships are on very niche and hard to fill topics, but it does mean we're looking for people, particularly on those projects. If you apply for a Churchill Fellowship, you'll be given the opportunity to select one or two sponsored fellowships if you want to, that you could be considered for. That will have no bearing on your overall consideration for a Churchill Fellowship, so it won't disadvantage you or necessarily advantage you, but it allows us to align and award Churchill Fellows who are selected to those sponsored fellowships. So in the case of health, we've got quite a lot of opportunities there in the sponsored fellowships. In particular, I'd like to mention the Western Australian Department of Health. They're offering a fellowship once again on topics that contribute to the sustainability of healthcare in Western Australia, and you can read about these on our website, and it suggests if you're thinking about that particular sponsor fellowship, do some research with WA Health to look at strategically what would align and interest them and benefit their work. The Bob and June Prickett Churchill Fellowship in an area of health. Bob was a Churchill Fellow and did leave a bequest to the Trust, and we award 3 fellowships in his name on different topics. And there's lots of other health specialties that are linked to sponsored fellowships, covering things like Parkinson's disease or surgical nursing, a whole range of things. So have a look on our website if this is something that you might think you'd be interested in. So when you're framing your project, you really should be asking yourself, how will it be of benefit to some aspect of Australian society? And make sure that you get that message through in your application and if you get an interview. So to apply, applications close on 28th of April. You apply online, no surprise there. We've got an application system that allows you to go in, start your application, save it, and come back to it numerous times up until the closing date. If you have a problem using the online form, look, and again, it could be because you have a disability and you can't access, the accessibility is not good, contact us, please. The last thing we want is someone to not be able to apply because they couldn't use our form. We'll find a way around that for you. Remember that you're competing against all other applicants. So in a typical year, and we've not had typical years for a couple of years now, we might get 1,800 to maybe 2,000 applications started, and we'll probably end up receiving somewhere around 1,100 applications. We will award around 100. So as you can see, the odds are not bad, but it's also very competitive. So keep in mind how you're going to convince the selectors to invest in you and your project idea. You're going to need 2 references, someone who can vouch for your personal characteristics and someone who can be an authority in your topic or your field. And top piece of advice here is to engage them early. One of the biggest challenges I see each year is applicants panicking on the closing date because they still haven't got their referee reports in and they can't track down their referees because they've gone on leave or some other thing has come up. So think about who can be your referees and contact them early, make sure they'll be available. You'll use the application form to send them a message and they'll fill out the referee reports via the application system. So it's pretty easy to do, but they do need to be available to do it. Churchill Fellows tell us time again that the whole process of filling out the application form helps them to refine and distill their project ideas. So again, I'd recommend getting in, starting an application and having a look through, have a poke around and see what the questions are so you can start formulating your thinking. The form's fully automated. One of the challenges that you may have is there are character limits. So you're going to need to be really clear and succinct in your wording. And that sometimes is a challenge for people. So again, you know, don't leave it to the last minute or it won't be your best application. Get in early and start that work. So your itinerary is obviously a crucial piece of your application and your project. And obviously limit your itinerary to destinations that will most benefit your project, but don't overcrowd your itinerary. So that can lead to fatigue and, you know, lower the benefits of the overall experience. So what we do recommend is that you allow some time to take up those meetings that you didn't know you're going to have because you meet people and they say, hey, why don't you go and meet with so-and-so? Your answer should be, yes, I can do that. Not, oh, I'm sorry, I'm hopping on a plane. I was only here for 2 days. So pad some time out. We want you to have weekends. We want you to be able to, you know, imbibe in the culture and get a real understanding of those environments that you're visiting. That's really important. You do need to put forward the most complete itinerary you can in the application, and that will be along the lines of, you know, I want to visit this country, this city, this organization or this person for this many days. So it might be 5 days, you know, 10 days, whatever it is, and map it out that way. You don't need to have locked in those meetings. You don't need to have spoken with those organizations, but you do need to be really clear on why it is you want to meet with them and what you want to do when you visit them. So it might be meetings, observation, it could be training. You know, have a really clear plan on what it is and why you want to do it. You do need to be specific at that point because we will use that information apart from assessing your application, and you'll get questions about an interview. If you're interviewed, we also use it for costing the fellowship. So a little bit about COVID. Clearly, it's had a massive impact on international travel. I did mention we've got fellows now traveling again, which is really exciting. We have allowed some virtual research to be undertaken. I've been getting some questions. Do I need to be vaccinated to apply for a fellowship? You don't need to be vaccinated to apply for a fellowship, but you certainly need to be vaccinated to travel internationally, and that's the whole point. So I think the answer's there. If you're not willing to do all the different things you have to do to travel internationally, to comply with different rules, then maybe a Churchill Fellowship is not for you. In terms of the selection process, we have panels and committees in each state and territory. Applications, as you probably expect, are shortlisted, and then there'll be interviews conducted. In New South Wales and Victoria, because of the size of the population and therefore the number of applications we get, there will be a first round interview, then a final interview. So the process is a bit bigger than it is in the smaller states and territories. If you go to our website, we do have on there the timetable showing when all the interviews dates have been set. It's important to know that about half of people who are interviewed are likely to receive fellowships, which is good news. If you make it to an interview, that in itself is a significant achievement. So the odds can be good then that it is a competitive process. All recommendations after interviews are completed are then reviewed by our board in September, and the board will make the final decision on those recommendations. So you'll find out if you're successful in September. If you don't get interviewed, you'll find out before then, obviously. And then you'll be able to travel from early 2023, and hopefully traveling internationally will be even easier, but it probably won't be like it was before COVID. We're often asked for tips about the application process, and the best tips I can give you are to read and address the selection criteria. It sounds obvious, but it's always good to do that. Use as little jargon as possible. It can be really hard when you're involved in something really deeply. Every day you're working in this space and you start to use acronyms or jargon or really technical words. Just keep in mind that while we have people from different backgrounds on our selection committees, they might not know what you're talking about. And you're not going to get shortlisted for an interview if you've got an application that people really scratch their heads about and don't understand. So try and use plain English, where you can be clear, be succinct if possible. So remember, it is a very competitive process. Most of the applications we get are going to be good. So you need to make yours stand out. Think about how you can make the burning platform of your project really clear, the benefit to the community really clear. Why you? Why are we going to pick you over all these other people? So it's not time to be shy. It's time to put yourself forward. Doesn't cost anything to apply. So, just get in there and give it a go would be my recommendation. So in case you don't get a chance to go to the website, here's our office number and here's the website address. So you can go online and search for other fellows who've been awarded. You can filter that by topic like health. You can filter it by state, by year. You can do keyword searching. So worth having a look to see what other fellowships we've awarded. So I'm now going to turn off my screen sharing and introduce our first speaker, Maida Stewart. So Maida comes from the Northern Territory. She was awarded her Churchill Fellowship in 2018, and she actually was awarded the Bob and June Prickett Churchill Fellowship to examine healthy housing initiatives in the primary prevention of acute rheumatic fever. And I think Maida will turn her camera on any minute. And Maida's passionate about working with Indigenous communities to build health and well-being, especially with people impacted by acute rheumatic fever and rheumatic heart disease, which I think most of you will know is a very serious issue. Maida is a Wemba Wagaya, sorry if I've murdered that word, woman who has lived in the Northern Territory for over 29 years. And on that note, I'll let Maida do all the talking for herself. Thank you, Maida.
Thanks, Adam. So thank you, everyone, for coming along to this information session today. I'll be talking about my Churchill Fellowship project and sharing some of my personal experiences on being a Churchill Fellow. So sorry about that. So my Churchill Fellowship looked at some of the healthy housing initiatives and programs that were developed in New Zealand as a way to try and reduce high rates of acute rheumatic fever in Maori and Pacific Islander communities. So the aim of my project was to firstly see how innovation is being used to develop these healthy homes programs for families with a household member that is diagnosed with acute rheumatic fever. I also wanted to explore some of the co-design methods that were being used with communities and families to develop these low-cost, high-impact, healthy housing interventions. I also wanted to find out what the New Zealand government was currently doing to try and increase the supply of affordable housing over there, and also how in Australia can we improve the living and build environments for Aboriginal and Torres Strait Islander communities, particularly with high rates of acute rheumatic fever. So some of the highlights of my fellowship travel included the cultural exchange that I had with Māori and Pacifica people while I was over there. And, you know, this includes particularly the sharing of our cultural knowledge, as well as many of our cultural stories. The generosity and the hospitality of people was absolutely amazing. They, you know, were so generous with sharing their knowledge and information. They were always checking in with me, making sure I had everything that I needed during my time over there. And so it was just so important for me to be able to have that network of people who were, I guess you could say, looking out for me, because that meant I could just continue to really focus on why I was there and to actually do my fellowship project. So I think one of the most surprising things that I found while I was in New Zealand was how poor the quality of housing really is. And that, along with things like low income, low wages, high cost of living, and high average weekly rental rates over there means that there are a lot of people and so many families that are really struggling to survive. So some of the things that I've learnt since returning to Australia from my fellowship include that, you know, there really is still so many opportunities for us to try and improve the living and build environments of Aboriginal and Torres Strait Islander communities across the country. I've also learnt that there actually are several things that we can be doing right now to try and improve people's living conditions. And one of the challenges that I had while I was away was having to not only learn about New Zealand's healthcare system and how that works, but also needing to learn about a few different systems, particularly the housing system, the social security and income support systems, in order to try and understand how the Healthy Homes programs work over there. And this was a really difficult thing for me to try and do in such a short space of time, which was 4 weeks. I think for me, the best thing about being a Churchill Fellow is that not only has it provided me with a number of professional opportunities, it's also given me so many more opportunities to continue highlighting many of the issues that relate to my project. So sorry, I'm just going to go back to that. Bear with me. I apologise for this. I actually skipped a slide there. So my fellowship has helped my industry and area of interest by also providing me with many more opportunities to continue raising awareness about acute rheumatic fever, and that it is a disease that still actually exists in Australia today, and also with continuing to highlight the impact that overcrowded housing and poor living conditions have on a person's health and their quality of life. So I've talked about that slide. So preparing for your fellowship, one of the things that I would suggest is to, as Adam mentioned earlier, to make sure that your proposed project will actually explore innovation in the area of your project that currently isn't happening in Australia. And I've also found it really helpful to sort of go through and check the Churchill Trust website and just to have a look at some of the other projects that the Churchill Fellows had done in the past, just to make sure that my proposed project hadn't already been done by someone else previously. And so the time and commitment that is required being a Churchill Fellow, I think, will vary. I've been really lucky in that I found that being a fellow generally doesn't take up too much of my spare time, because I've been able to integrate that into my work as part of my job anyway. However, there will be busier times for you, and these will include times where when you return from your travels and you begin disseminating the findings of your project through conferences and workshop presentations, through meetings, through doing media interviews and so on, and also in promoting the Churchill Fellowship program. So that's it from me. Thank you for your time.
Fantastic. Thank you, Maida, for your presentation, and you're very modest. So Maida's doing some great stuff. I would now like to introduce our second speaker, Niroshini Kennedy. So maybe swap cameras. And Niro was awarded her Churchill Fellowship in 2018 in Victoria. It was the Jack Brockhoff Foundation Churchill Fellowship to investigate integrated models of care for Aboriginal children in out-of-home care. And Dr. Kennedy is a developmental and behavioural paediatrician at the Royal Children's Hospital and at the Victorian Aboriginal Health Service. So her clinical work involves the care of Aboriginal children in the child protection system and in state care. So I think I'll let Niro start presenting, and I'll hide. Thanks, Niro.
Thank you, Adam, and thank you for the opportunity to speak to prospective applicants. And I'm really grateful for the opportunity that the Churchill Trust and the Jack Brockhoff Foundation provided me in being able to undertake this study, and really hoping I can share some of my enthusiasm for what a Churchill Fellowship might be able to offer for your project that you're passionate about. So, you know, as Adam mentioned, I was awarded the 2018 Jack Brockhoff Foundation Churchill Fellowship, although it really doesn't seem like that long ago that I was sitting in the audience at a similar session and preparing to apply for my fellowship. And it's really lovely to be sharing, you know, what my project has meant to me. So my fellowship was looking at investigating integrated models of care to deliver health assessments and healthcare for Aboriginal children in the statutory out-of-home care system, with ultimately the aim of improving the health of Aboriginal children in out-of-home care. And out-of-home care, of course, is the term used to refer to children who are placed in kinship, foster or residential care under statutory child protection orders. So as Adam mentioned, and as you might be able to pick up from the room I'm in, I'm a paediatrician, and I work at the Royal Children's Hospital in Melbourne, where I got a long service award for 20 years last year, which made me feel terribly old. And I've also worked in Aboriginal health for 8 years at a community-controlled Aboriginal health service in Melbourne. I'm a fellow of the Royal Australasian College of Physicians, and in addition to the Churchill Fellowship, I've also recently been doing a policy impact program, which is helping me to put some of the policy, I suppose, the policy lessons from my fellowship into practice. So my journey into this sort of work started when I was working as a forensic or child protection paediatrician at the Royal Children's Hospital, where I was performing medical assessments and providing expert opinions for the child protection system and for court of children with suspected child abuse or neglect. And that was a pretty tough job, but what it did was open my eyes up to a couple of things. One was the growing overrepresentation of Aboriginal children in the out-of-home care system. And as you can see, at the moment in Australia, Aboriginal children are 10 to 15 times more likely to be in statutory care than non-Aboriginal children. And the other thing that it opened my eyes up to was how few of these children, after we made the diagnosis of, you know, abuse or neglect and they entered the system, how few of them received even the minimum standard of healthcare that was recommended in national guidelines, and even in my forensic report that might have, as well as, you know, making some comments about what they had come to me for, the forensic report often made mention of perhaps developmental concerns, general health concerns, dental problems. And what this really came down to was that we've got a real problem in Australia, in that we've got great national standards for the healthcare for children in out-of-home care, but we actually don't have the health infrastructure for this to happen. So we have very few publicly funded health services that can actually deliver the very comprehensive assessment and treatment services that these children need. And what we also found, and this is particularly a Victorian problem, is that we had very limited dedicated service. So we had some services in mainstream hospitals, such as the Children's Hospital, but they were not culturally safe. They were offering a one-off assessment and no ongoing therapy. So we found that very few Aboriginal children were actually taking up those assessments, and by extension were not getting their health problems diagnosed or treated. So as you know, as I've outlined, we really do have a problem in Australia. This is really a crisis. One in 3 children in statutory care in Australia is Aboriginal. Now, Aboriginal children only make up about 5% of the population of children in Australia. So this is a really gross overrepresentation, and they're 10 to 15 times more likely to be in statutory care than non-Aboriginal children. These children are also very high and unmet health needs, and these rates are actually rising. So in terms of my trip, and it's kind of bittersweet looking at this trip, because I travelled in September and October of 2019, just before the pandemic, and it's a bit surreal looking at how much travel I fitted into 6 weeks. But my trip took me from Melbourne to Wellington in New Zealand, to Los Angeles, to Albuquerque in New Mexico, across to Anchorage in Alaska, and then across to Canada, to Edmonton, Ottawa, and Montreal, and then across to Chicago, Milwaukee, Syracuse, and New York. And that was in 6 weeks' time. Essentially, the aim of my fellowship was to do a couple of things. One was to look at specialised medical home model multidisciplinary hubs for children involved with the child protection system. And that's really the predominant model that most of the world uses to deliver care for vulnerable children. To look at integrated care programs for Indigenous communities. So integrated care is a form of patient-centred healthcare, and it's a term used for a type of healthcare reform that really aims to wrap around healthcare around the individual, and which is to tackle sort of the fragmentation that we have in our current health system. Also, I looked at something called collaborative care, and that's a model of care where mental health and medical services are co-located and integrated in their delivery. And I also conducted some interviews with influential policymakers, researchers, and advocates in the field of Indigenous child health and child welfare. And many of these people are people who I had been corresponding with over the years as I looked at ways to improve the system for the children that we were caring for. So in terms of the highlights, it's really hard to limit this to a few slides, because there was just so much there, and it really was an extraordinary experience for me as a clinician. And I think my journey into this was really as a clinician. I didn't know how to approach this problem and get it into a workable solution. And so some of the highlights for me were meeting with Cindy Blackstock in Canada, looking at a Indigenous-led model of care in Anchorage in Alaska called the NUCA system of care, meeting with Brian Samuels, who was President Obama's chief child welfare policymaker in the federal administration, and meeting with Astrid Heger, who is a child protection paediatrician who has put together a really remarkable model of integrated care. So Cindy Blackstock, I came across her work when I was struggling with the fact that service design for Aboriginal children in Melbourne was so inequitable. So what we had in Melbourne was a system of out-of-home care clinics, which are run in mainstream health services. Now, they were not set up to exclude Aboriginal children, but the way they were run, the way they were targeted, meant that very few Aboriginal children accessed these assessments. What we found that in about 5 years that these clinics were running, only 13 Aboriginal children had health assessments through these clinics. Now, there are about 2,000 Aboriginal children in out-of-home care, so you can see how stark that discrepancy is. So services were not set up in a way to unintentionally exclude children, but they were just not taking into account the needs of the most vulnerable, and they were almost an afterthought. And Cindy Blackstock had a similar approach to tackling some of the inequities and discriminative practices in the child welfare system in Canada. So again, the First Nations children in Canada, very similar story of overrepresentation. They have there a similar thing to our stolen generation in terms of the Indian residential schools and what's called the 60s scoop. Lots of parallels. And Cindy Blackstock was an Indigenous social worker who has really become a really powerful advocate and has actually taken the Canadian government to the Human Rights Tribunal, has won a number of landmark human rights cases, which has really changed the landscape for healthcare for First Nations children. The first was something called Jordan's Principle, where basically the state is not allowed to have discriminatory practices against First Nations children. They have to be prioritised. And the second is one that has looked at reparations for children who've been, First Nations children who've been discriminated against in the child welfare system. And she's been described as a relentless moral voice for Canada's First Nations children. And really meeting her was absolutely inspirational for me. Traveling to Alaska, I was really, it was so far from Melbourne and Australia, but what I learned there was felt to me like the future of healthcare. The South Central Foundation in Alaska is a native-owned health service, which is responsible for 65,000 Alaska Native people. Now, prior to 1998, the healthcare was delivered through what's called the Indian Health Service, and which is a federal-run program. And the health outcomes were terrible. Health outcomes for this population were in the bottom fifth percentile for the US. In 1998, the Alaska Native people took over ownership of their health, and they developed a new system of care which reflected their own values and the principles of community members taking responsibility and partnering to improve their health. It's really a relationship-based care. And what they have done is they have improved health outcomes dramatically. They have gone from the bottom fifth percentile to the top 10 to 25th percentile in terms of some health indicators that are tracked across health services in the US. They've reduced hospital costs. They have reduced hospital and emergency admissions. And they have won a congressional award for quality in healthcare twice. And the way they have done this is really through integrating traditional healing and culture right through their service. And you can see some beautiful examples of some artwork there. And really the model of care is patient-centered with co-located mental health clinicians for every clinic. So you turn up to your diabetes clinic, there's a mental health clinician there. You turn up to your respiratory clinic, you've got a mental health clinician there. And they really used data and evaluation in a really, really smart way. And again, you know, it really felt particularly when I'm working in the sort of clinic model that we have here, which is a very traditional sort of outpatient model, this really did seem to have a glimmer of hope to address some of the, particularly the mental health problems that we're seeing right across the health system at the moment. So Brian Samuels, again, was, you know, meeting him was a huge highlight of my trip. He has an interesting personal story. He grew up in out-of-home care himself in a group home in Chicago, and later grew up to sort of ended up heading up the child welfare system in Chicago, and then moving to DC, heading it up under the Obama administration. And he says that health and well-being should be the measuring stick of the child welfare system. So traditionally, child welfare system has focused on safety and permanency, which are absolutely important. But for him, the game changer has been pushing this idea that children who are involved with the child welfare system should benefit from being involved with the system. If we are doing this drastic intervention of removing children from their families of origin, well, what are we adding to their lives? And that's been a compelling argument that he has put forward, and it's led to some amazing reforms which have led to a greater, less variation in care and better outcomes, and improved health and well-being for children in out-of-home care. Astrid Heger, again, one of my heroes who I knew very well from my work as a child abuse paediatrician. I read her textbooks on the care of the sexually abused child. And she has made an amazing, you know, transformation in her career from being a very technical focused forensic paediatrician and really a pioneer in that field to actually saying, you know what? that's not enough. It's in the details. And what she has done is, in addition to offering the forensic evaluations in this multidisciplinary hub, she has ongoing programs for medical assessment and treatment of children who've experienced childhood trauma, as well as a range of wraparound services. Really, her model is just really very personalised and thoughtful, and really puts the child at the centre of everything that they do. So in addition to everything I did, I couldn't resist putting some happy snaps of my trip, and it always makes me so happy to have an opportunity to share this with you. But on my trip I was able to see some amazing things. When I was in Montreal, I stumbled onto I think there were about 500,000 people marching in the streets of Montreal with Greta Thunberg on a climate change rally, and it was quite something to be part of that crowd. For someone like me to see an Alaskan, to be on see some Alaskan icebergs was also a huge thrill. So there were many lovely moments on that trip, quite apart from the what I learnt. In terms of how the Churchill Fellowship has supported my work, this has been a really hidden, neglected issue, and it's helped me to advocate for what's a neglected issue. Obviously, I'm a clinician, and it's really helped me, and this is something I'm still learning, I've still got a long way to learn, but it's helped me to see this as a health system and a policy, have the policy perspective on that. And I'm very grateful for the opportunity to be part of the Policy Impact Program, where I'm hoping to learn some more skills to make this into really actionable policy. It really helped me to see up close some insights into possible solutions and see some different ways of offering healthcare that really might be the way for the future in Australia, not just for Aboriginal children in out-of-home care, but really system-wide. Helped me to build on some networks professionally of people who have similar interests and commitments. And certainly it has helped with our advocacy work locally with our State Department of Health here, as well as some policy work that I'm doing at a national level with the Royal Australasian College of Physicians. So in terms of advice, I just agree with everything that Maida said. I think believe in your project and persist, and don't give up if you don't get in the first time. I applied 3 times before I was successful, and really my project application was essentially the same. And so if you believe in your project, please don't be put off if you don't get through the first time. Again, I would really urge you, learn from my mistakes. Have an early discussion with your referees. They're busy people, they take leave, they have other commitments. Get them on board with what you want to do, so they have a good understanding, so they can provide you with a reference that makes the case that you want to make. And also discuss leave options with your employer, because taking a chunk of time away, 4 to 8 weeks, obviously having that discussion early is wise. So just a final word, have to finish with a Winston Churchill quote, and all the very best. So pleased that you're considering applying, and certainly wish you all the best.
Awesome. Thanks, Niro. Some great advice there at the end as well. And I think channeling a bit of Winston Churchill with that persist, never give in. And I think Churchill would give in, he would complete his application. So we've now got some questions and answers. Thanks, particularly Lynn, for your questions. You've given me a few, which is good. Starting though, Amy has a question regarding the personal reference. Who would be an ideal person for this? Could it be a spouse, family member, or friend? Look, I guess technically it could be a spouse, family member, or friend, but I probably, encourage you to only do that if there's a really good reason, like they are, I don't know, an expert, the best person really to comment on you. But I guess as a personal reference, we're really looking more for probably someone who has worked with you, or has known you for a long time through a network or a related, connection with your work or your project, someone that can talk about having seen the way that you hold yourself, the way that you follow through on your commitments, your passion, your drive, those sorts of things. Ideally you wouldn't use family. A question from someone, they've got a project that has similarities with a Churchill Fellowship that was awarded 7 years ago. And they can see it's an extension of that project with significant benefit remaining. So I think you've probably answered your question there. Yes, that would certainly be eligible. Selection panels will often remember projects that they might have been involved in selecting, and they'll say, oh, didn't we do one of those? But to be honest, 7 years, a lot's changed, particularly over the last couple of years. I think if you can clearly identify that what you're doing isn't just replicating that project that was done a few years ago, that you're building on it, that's fantastic. It's not uncommon for applicants to have met with the previous Churchill Fellow and discussed their project with them. And I've seen people come to interviews and put forward quite a compelling case where they've been able to talk to the Churchill Fellow, and they've talked about what they've learned and discussed with them and how they're going to build on that work. So I hope that's helpful as an answer. So when you finish your travel, you return to Australia, we give you 10 weeks to complete and submit your report. Now, that can be a written report, it typically is. You might do a podcast or a video. We're starting to see more of those creative approaches being taken, which sometimes, depending on the target audience for your information, can be a more effective way of communicating. But effectively, you've got 10 weeks to do it. One of the tips that many fellows give is, while you're on your fellowship, take some notes, and sort of start drafting it as you go while it's fresh in your mind, and then it makes it easier when you come back. And maybe think about, if you can afford to, block out some time on your return to just knuckle down and break the back of that report. Now, you can take time off during your fellowship for personal self-funded travel. You can certainly extend the time as well. I guess my advice would be probably to think long and hard about taking a break in the middle. If you're going, say, for 8 weeks, which is the maximum for the Churchill Fellowship, for a couple of reasons. One, you might lose that kind of momentum. Two, if you do take a break in between your visits to other countries as part of your fellowship, really be careful not to engage in high-risk activities like, I don't know, skiing, because we've had fellows injure themselves and, very disappointingly, had to leave or get taken back to Australia, and from there never completed the fellowship. It was just too hard to find time to go again. So that would be pretty disappointing. So look, my preference would be, if I could influence you, take the time at the end, so at least you've got all that hard work done, because all the preparation going into it, you don't want to cut it short. You can take family members with you if you want to, or you can leave them home. That's up to you. Some people meet their family along the way or at the end of their travels, and then you're already over there, so you've saved part of the cost of a holiday, so you can do that as well. That's up to you. All the travel for the fellowship is booked through FCM. It's the travel company we're using now. So you get some choice in the airline, but obviously they'll book the most appropriate fares for you. If you have family attending or a friend coming with you, you can book through FCM as well to make sure you get seats near each other, all that type of thing as well. So that's all possible. And if you want to book personal travel, again, you can use FCM, but you don't have to. So that's that. A few more questions coming in. I have a question regarding the place or the organisation or the person that you're planning to visit. What sort of commitment would you need from them? I think in terms of your application, you don't need a commitment, but it'd be useful to have a good idea that they're open to receiving international visitors. And particularly, I think at the moment, for the next little while anyway, hospitals and other health-related organisations may have policies in place that they aren't accepting international visitors for a while. So do a little bit of homework on that front, but you don't need to have had a discussion with them at the point of application or even interview, but you'll be asked about your itinerary and your proposed visit. So just be prepared to understand if they are likely to meet with people. In the event that you're awarded a fellowship and you find out that one of the places or two of the places you wanted to meet with isn't possible, obviously there'll be opportunities to tweak your itinerary a little bit after that point. Would it be advantageous to have clear deliverables regarding how the community would benefit? For example, I would talk to XYZ policymakers to share my knowledge. Yes, great example. What we don't want to see is simply, I will get a journal article published. I mean, this is a trip around the world. It's massive, huge opportunities. We want to see more than a journal article published. That'd be great, but we want more than that. So I think, yes, some specific examples of how you're planning to share the knowledge or even better, generate some impact, get some change happening in your project is excellent, and that would certainly make a strong application and interview. Can you do the travel anytime in 2023? So if you're successful this year, you'll be able to travel from 1 February 2023. We give you 12 months as a window. So as long as you've left by the end of January 2024, which sounds like a long way away, but it's not, that's the standard time. On occasion, we'll give people an extension of another 12 months if something unexpected happens in their life that can prevent them from travelling. So some great thanks for Maida and Nero for your presentations, and feel free to put your cameras on if you want, guys. This person is interested and encouraged to hear that sometimes you need several attempts to succeed in an application. So their question is, what changes to the application made it successful? So I don't know if Nero or Maida wanted to answer that question. I can say from experience, I've sat on a lot of interviews over a few years now. Look, sometimes it might not be that you needed to change your application a lot. Each year, the field of applicants is different. And so, you know, this year you might put your application in and not get selected. But if you put the application in next year the same, the field in your state or territory might be just a bit different or a bit weaker, and you might have gotten up. So it's not necessarily that you needed to change something. But Nero or Maida, do you have any thoughts on that?
Yes, my application didn't change substantially. I think on one occasion I had slightly different referees, but that was more to do with sort of availability of people. But yeah, I think as you said, you know, it's about that year's mix. And so if you believe in your project and you've put the time and effort into, you know, obviously by all means look at it, you know, look at it critically to see if there's something there. But if you really believe in your project, and I think this is something that I've having met many other Churchill Fellows and reflecting on what Adam said, you know, I think often people who are drawn to apply for a Churchill Fellowship are sometimes, you know, tackling something that they're really passionate about, which obviously by definition, you haven't been able to address through the usual pathways. So if it's a little bit different, that's kind of actually what the problem is, and maybe a reason why you need to go down this path. So yeah, believe in your project and yeah, keep persisting.
Good advice. Maida, did you want to add something?
I was actually really lucky, and I got awarded a fellowship the first time around, which really shocked me. I almost fell off my chair when I got the email notification. I'm not entirely sure what it was that got me my fellowship on the first go. I think, and I hope and would like to think it was because of the level of passion that I showed and how important my proposed project was to me, to my family, and my community, as well as many other communities out there. So I think just in adding to the slide that I talked about with regard to advice about your fellowship, I think it's, you know, if you can sort of really try and show your passion and, as Nero mentioned, believe in what you're doing, believe in your project as well.
Yeah, that's spot on. I think, Maida, the selection committees can always, you can feel the passion. You know when someone's really, really dedicated to their project, and you know when someone's just looking for another sort of source of funding for something that they're just doing as a job, and they're not particularly committed to it. And that does come through, absolutely. So what if you get the fellowship, but due to unforeseen reasons, you can't confirm all the proposed hosts for your trip? Do you have to provide alternatives? So actually, it's a good question, because just to explain the process, you'll put your itinerary in your application, you'll talk about that interview, and we'll award the fellowship based on you saying, I'm going to this country for this many days, meeting these organisations, then I'm going to this country, these cities, these organisations. That will, you know, I guess, form the backbone of your project. But of course, there will be some changes almost without fail. We ask you when you're ready to getting ready to undertake your travel, to put together a final itinerary, which we'll sign off on before you can book your travel. And that's where you'll do some of that refining and say, oh, gee, I can't meet with that organisation, but look, I've reached out to them and they've said, sorry, we can't do it. So I've now discovered there's this other organisation that I hadn't thought of before, and I've talked to them and they're going to meet me. So all that kind of refining will happen after your fellowship's awarded. We typically can't, because of the cost, you know, if you said, look, it's a 4-week fellowship just going to New Zealand, and then we award it and you say, well, no, I've thought about it. I'd like to actually cancel New Zealand and do 6 weeks in New York and 2 weeks in London. That's going to cost, you know, 5 times as much, and we won't have budgeted for that. So we can't allow, you know, huge changes, and there'll be obvious questions like, well, why didn't you think of that when you applied? So I think some minor changes and tweaking is pretty normal. Yeah, so I don't know if Nero or Maida have any insights into what you had to do when you did your final itineraries.
I actually didn't have to do too much, so I was pretty lucky. What I did do over there, and unfortunately I didn't quite get around to it because COVID was just beginning to happen. So there was the peak Māori housing service up in Northland, so right at the top of the North Island. Someone had suggested to me that I met with to maybe speak with people there. I hadn't planned for that in my trip, so the way I was going to get around that was actually by doing a Zoom or an online virtual sort of meet up with them. And because I hadn't sort of allowed for that in the budget that I was given to do that additional travel, and just with a really high cost of living while I was over there, so it sort of limited me. But that, and I did, I managed to catch up with the person later on when I got back to Australia. But that's a possible alternative, rather than having to sort of do a detour somewhere else, is that you might just do it virtually.
Yeah, I think that's a good point. Yeah, the world's changed. We're all zooming around the place and using other technology. And yeah, I think people are more open to doing that now, and it can be a way to work around problems. Lena, so just ask for some clarification. So you give proposed dates in the application, but from what I'm saying, those dates can change. Yeah, so we really focus on how long you're going to be in those countries and who you're meeting with and what you're going to do. The actual dates in terms of I want to go in July or September, that'll change almost certainly, unless, well, actually one thing I probably should add for those of you still tuned in, don't focus your Churchill Fellowship on a conference that happens every July in wherever, because that's not a strong application. If there is a conference that happens to occur that you think, gee, I could attend that if I go, that's fine. But don't hang all your hat on a conference. We can allow some funding to attend a conference, and sometimes that does influence when people want to go. But I think unless that's a really amazing conference that's going to be the main part of your fellowship for some reason, think about when the best time is to meet with those organisations and people. And that could be when they're really busy doing the things you need to be involved in, or it could be when they're a bit quieter and they've got time to meet with you. So really put some thought into that aspect of it would be my advice in terms of the overall timing. All right, so I think we're probably over time, and I'd like to once again thank Niro and Maida for your great presentations and sharing your insights and knowledge. Thanks everyone who's attended, and as I said, if you have any other questions, feel free to get in touch with the Trust, and if you apply, good luck. Thank you.